The term cultural intelligence varies across different cultures. However, it is commonly thought of as the knowledge base that forms your awareness of how you conduct yourself in multicultural experiences. It is being able to recognize people's behaviors, their views, and perspectives as a result of culture. In the workplace, cultural intelligence is being able to adjust your behavior and be considerate and respectful of others from culturally diverse groups. In this presentation, I will provide illustrations of the concepts of cultural intelligence and examples of how these concepts can be applied in a healthcare environment. Healthcare provides a culturally diverse workplace for health professionals and their patients. Effective communication is a very important concept of cultural intelligence. In healthcare, simply repeating an order that a doctor has given or summarizing what a patient has said provides confirmation and understanding of what has been spoken. Part of effective communication is interpretation and paying attention to a patient's particular situation, their needs and behaviors. This provides the patient with a sense of reassurance, respect and trust. Communication is very important in healthcare to assess the patient's values, beliefs and practices. It also allows a professional relationship between staff and patients. According to Brisling, Worthy and McNabb, 2006, cultural intelligence can refer to people's success or their behaviour. Suspending judgment on people from different cultures or even from a different socio-economic background is often a difficult task. In nursing, it is sometimes easy to pass judgment on how a patient presents. For example, it is important to effectively listen to what a patient is saying rather than assuming that the patient is simply seeking opioids or attention. Actively listen to the information being spoken, ensuring the patient's body language matches their conversation. A culturally intelligent nurse can identify the important information required in making an assessment, allowing for an accurate, more concise conclusion. Triandis, 2006, states that a great deal of information needs to be gathered about someone before judging them. Flanger, 2009, describes culture shock as a distressed, uneasy experience when in an unfamiliar environment or culture. Going to hospital can be an immense shock. For instance, in some cultures, it is the responsibility of the patient's family to look after and stay with them in hospital. However, when being admitted to a hospital here in Australia, patients' family are generally not able to stay overnight in the hospital, and this is often distressing for the patients and their families. This is identified as culture shock. A culturally intelligent nurse needs to be aware of and identify culturally diverse issues to ensure a positive reassurance to the patients. In conclusion, healthcare is a culturally diverse environment that requests nursing staff to show awareness and implement the concepts of cultural intelligence. Effective communication skills, suspending judgment, and being culturally sensitive will ensure positive working relationships between other health professionals and patients. Cultural intelligence is knowledge learnt and is the ability to show empathy to other person's beliefs, values, behaviours and attitudes.